Good evening. Thanks so much for joining us here tonight for Atlantic Concussion Awareness Day 2022. Happy to have you joining us here from beautiful downtown Dartmouth, Nova Scotia. I'm Adam Detienne, pleased to be the host here tonight. What I can tell you from a lifetime in sport as a player, coach, referee, TV broadcaster, there's never been a more important time than now to spread the word about concussion awareness. What a great initiative this has been here in Atlantic provinces. Culture and sport are synonymous around here, so we do want to take a moment and acknowledge all those who've been negatively affected by Hurricane Fiona in our region. Our hearts are certainly with you, and if you can't join us here live tonight, this broadcast will be housed online in an archive for you to view when you can. For those of you out there able to donate, the Canadian Red Cross Hurricane Fiona Relief Fund is still out there, and the Canadian government is matching it right now, dollar for dollar. Get out there and help out if you can as well. For those of you looking for the French language broadcast, please select a French language translation option. It will be live translated here tonight, so you'll be able to pick up this entire broadcast in French. So I'll give you a little outline of what's going to happen here tonight. We'll be here about an hour long. We'll have a great list of presenters, great panelists here, and we'll finish with a Q&A session at the end. We've received more than enough great questions from people who have signed up for this broadcast here tonight, and we'll promise you to try and get to as many of those as we can as we get towards the tail end of this thing. So without further delay, let's get right into things. When you think of concussion, one of the first things that comes to mind is a rink or a field or a court in our region. But tonight, we're going to start things off in the barn. We'll bring to you equestrian Jessica Swinkles, and she's going to share her story and experience with concussion.
I am Jessica Swinkles, and I am a longtime equestrian. I have been riding for 25 years, and I am now an instructor, and I have a few students of my own that I've been teaching. My horse Nico, he got his foot stuck and he fell on the train track, and my body just kind of still laid lifeless on the train tracks. I don't remember really any of it, and when he fell over, he got up. He was really panicked, so he got up and he ran back to the stable. But then it was so lucky because my father was actually watching when that happened, so he was able to do something immediately about that. Someone who's just starting riding, they'll ask me, a kid, they'll ask me, can I get hurt doing this? And the answer is yes, you can. You can get hurt doing this. But that's why we are safe about things and we wear a helmet. I was wearing a helmet, thankfully, which is good because I really think that I'd be dead if I wasn't. I've never ridden a horse without one. Luckily, that was kind of taught to me as I learned to ride, that's the first thing you do is put a helmet on before you get on your horse.
Thanks again to Jessica for sharing her story. It really speaks to how, although there are many diverse ways to be a participant in sport, universal themes like safety equipment and helmet use certainly shine through. So thank you again to her for being here tonight. And thanks to you for being a part of our conversation on concussion, coordinated by the Atlantic Concussion Awareness Week work group. This group had tremendous representation from each of our Atlantic provinces, with government sport officials providing a lot of the info and things you see here tonight. So thank you to the work group for sure there. Our original data broadcast was September 28th, which was National Concussion Awareness Day. Hurricane Fiona put us back a week, but we certainly thank you for your patience there. The education and information surrounding concussion certainly is continuously evolving. So in the last year, 2021, which was the first year each of our Atlantic provinces took part in concussion awareness training, a lot has changed even then, so we appreciate you being here tonight. Which brings us to our next guest here tonight, Mr. Gordon Stringer. We are so honored to have Gordon here to share his family's story with us. In 2013, Gordon tragically lost his daughter, Rowan, to concussion. And in what was an obviously painful time for the Stringer family, they came together and through their effort and dedication became a driving force behind the national movement in concussion education. We are so pleased to have Gordon here tonight to share his story personally. So I'll pass it over to him now.
Hello, my name is Gordon Stringer. Thank you all for tuning in to listen. I'm the father of Rowan Stringer. You may not have heard her story, but back in May of 2013, over a period of 6 days, Rowan suffered what we believe would be 3 concussive events while playing high school rugby. This information was all found out through an inquest into her death that was held in 2015 in Ottawa. And through that inquest, a lot of things were learned about how preventable her death was. And that was one of the key messages that came out of the inquest, was that her death was preventable. So coming out of the inquest, there were 47 recommendations made. Those recommendations went to the Ontario government. And from there, the government put in what was the first concussion legislation, which was the Rowan's Law Advisory Committee Act, which formed a committee to advise the government on how best to implement those 47 recommendations that came out of her inquest. One of the key messages out of the inquest was education and prevention, increasing awareness. These are all very important things, but other elements were increasing or focusing more training in medical schools and other healthcare professions on identifying and treating, managing concussions in whoever. The focus was on students, but it ultimately ended up being the population in general. So for the last 4 years, the government in Ontario has been busy implementing those recommendations. They've done all of there were 21 recommendations that came from the advisory committee, which essentially boiled down the 47 that came out of the inquest. And of the 21 final recommendations, 18 have already been implemented in Ontario, and they're working on the final 3 now. Over those 6 days, Rowan had it was like a preschool tournament on the Friday. It was an all-day tournament. They had 3. They weren't full games. They were like, kind of half games during the day. And during the last game, I was not there. My wife and my daughter were there. They had left I think they went to Tim Hortons to pick up a coffee or something, as parents do when they're watching their kids playing sports. When they came back, Rowan was off the field, but they didn't really think anything much of it because she'd been playing all of the first 2 games, and they came back partway into the 3rd game. So they thought, well, it was probably just time for her to have a rest. Nothing was said. Rowan didn't say anything. Her coaches didn't say anything. But apparently during that game, the reason she was removed was she took a hit, which kind of knocked her a little bit off. So on the Saturday, she complained about having a headache, but that really wasn't out of the ordinary. Rowan she got headaches once in a while, and we didn't see anything unusual about that. She took some Advil, Tylenol. Sunday, she was up, seemed to be fine. She seemed to be herself. We had a family get together. Everything seemed okay. Monday, she had a game, actually her first game of the season. And during that game, again, she took a hit, apparently to the head. I think it was a knee to the head during that game. But she also, somewhere during the game, she got hit in her upper thigh, and she had this huge bruise on her upper leg. So when she got home, that was, the visible injury was the thing that was the focus. This huge blue and purple bruise on her leg. She seemed relatively fine. She went on her social media and was posting pictures of her bruise and all this kind of stuff, as kids are wont to do. Tuesday, she didn't complain about any. Monday, she didn't complain about anything other than her sore leg. Tuesday, we got up and she had her driver's test. So I took her to her driver's test, and I'd been helping her, coaching her along with practice driving and whatnot before, and I thought this was just going to be a formality. But she came out of that and she had failed. And I thought, well, that's kind of odd. I didn't really expect that. So we found out during the inquest, they had the driver's education fellow from the Department of Transport come in and testify regarding her driver's exam. And what he said was he pulled the file, and he said, if I didn't know that this was her, a 17-year-old girl, he said, from my 20 odd years experience looking at the results, I would have thought that this was the result of an older person who was coming in to take an exam to try and keep their license. He said there were so many judgmental errors in perspective on distance, timing. He said it surprised me when I pulled the file, because I didn't remember it at all, but I looked at it and I went, if somebody handed this to me, it would have been I would have guessed an elderly person taking an exam. So that was a little bit of a shock too, because obviously she was having mental problems, coping with judgment, etc., which of course is one of the signs of a concussion. But we didn't learn that until the inquest into her death. Now on the Wednesday, I took her to school in the morning to drop her off, and she had another game that afternoon. And I said to her, all we had at that point in time was the big bruise on her leg. And I said, maybe you should think about sitting this one out, let your leg heal a little bit more. And she said, oh, come on, Dad. I've had injuries before, and I've played, I played ringette with sore shoulder and all this kind of stuff. I said, well, think about it, because it might be a better idea to give her rest. Yeah, I'll think about it, the typical. But anyway, she decided she was going to play the game. And during that game, she was given a swing tackle, which in rugby is an illegal tackle. It's against the laws of the game. But she was running with the ball with her momentum going forward, and one of the opposing players essentially grabbed her by the jersey and threw her with her momentum in the same direction she was running, but she was airborne. And our assumption is everybody said she was hanging onto the ball, and she kept hanging onto the ball, but unfortunately with that, she didn't have anything to brace herself when she hit the ground, and she apparently landed basically on her head. She apparently sat up on the field briefly, put her hand up to her head and kind of squinted a little bit, and then she lost consciousness. The ambulance was called. They got her she was 17, so she was eligible to go to the Children's Hospital, which was probably a good thing in this case. They have some very good neurologists, pediatric neurologists that work there. So I was given a call at work. I think it was the coach of the team said she'd been taken by ambulance to CHEO, which is a children's hospital of Eastern Ontario. I packed up my things as quickly as I could and headed to the hospital. When I got there, she was in ICU. They wouldn't let me go in, but I could see through the door. There were more medical people than I'd ever seen in one place in my life. All around her, she was on the table, still unconscious. They were trying to intubate her. They were having difficulties doing that. And eventually they did get her intubated. The neurologist came down and said, we're going to have to do surgery. And so he explained to me what was going to happen. They were going to, I forget what the medical term is, but essentially they remove about half of your skull bone. And they were hoping that with this, it would help to alleviate the pressure. Her brain was swelling rather rapidly. And they were hoping this would allow for the brain to swell, but not keep so much pressure on the brain stem that it was going to be problematic that way. So over the next few days, she was on various monitors, measuring her intracranial pressure and, trying to keep everything normalized as best as they could. There really didn't seem to be much improvement. She seemed to have, little points here and there where things seemed to get a little bit better, but she never regained consciousness. She was essentially, I guess, in a coma or a kind of a comatose state while her brain was swelling. Finally, on Saturday, the doctors came and they took us aside, and it was kind of that talk that no parent ever wants to have. But they essentially explained to us that they kind of felt almost everything had been done. There really wasn't any sign of improvements. They offered the possibility of removing the other half of her skull to see if that would help. But they said, we asked, what do you really feel about that? And they said, well, at this point, they don't think it would make much difference. The brain was just swollen so much, and there was ischemia all through about 70% of her brain. So we made the decision at that time to honor Rowan's wishes, which she made when she got her learner's permit and to drive. She signed up as a organ donor. So we requested that they, do everything they can to maintain things so that her organs could be donated. She had still not been declared brain dead at that point, but they thought that it was something that was imminent. So by Sunday at noon, they made the declaration of brain death. And at that point, she was, they just needed to get her prepared to go and donate her organs. We were glad to hear on Monday morning, we got a call from the Trillium Gift of Life folks in Ontario, which is the group that coordinates organ donation in the province. And they called us to let us know that all of her organs, her tissues, and her what they could get out of her eyes. I'm not sure if that was just corneas or what it was, but anyway, everything was viable and everything was usable. So she had helped 7 or more people through her donation of organs. We've actually had the opportunity to, through Facebook, we just randomly connected. We had a Facebook page going called Rowan's Recovery while she was in the hospital. And this woman had been following it, and she made contact with us, and she said, I think I might have gotten Rowan's lungs. And so anyway, we put puzzle pieces together, and she was indeed the lung recipient, and she's St. John, New Brunswick. So we've had contact with her. We found out again through other means that we believe her eyes went, one of her eyes went to a father who had been blind all his life. And through Rowan's gift, he actually got to see his children. So that was pretty special. So that really is, the background of Rowan's story. Rowan's Law in Ontario is a very important piece of legislation. It's the only legislation in the country right now regarding concussion, prevention, awareness, treatment, education, the whole gamut. I'm really of the belief that this is something that should be implemented in every province and territory. Ontario has done the heavy lifting on this. We've had the inquest. We've had the expert advisory committees, which had people from health, education, public health, children's health. There were experts there. Neurologists were on the panel. Brain Injury Association. Just anyone who should have been there was on that panel to make the recommendations to boil these things down. So the heavy lifting has been done. Ontario is almost finished implementing all of the recommendations that came out of the advisory committee. So there's a program that's in place. It's been functioning. It was used in the Summer Games last year, which were held in Niagara Falls. Rowan's Law was part of that entire competition. So athletes from across Canada were subject to its rules and regulations during the Summer Games competition. So it's not something that's foreign to everyone across the country. And I think it would be relatively easy. I know there are federal, provincial, territorial government meetings where they've discussed a possible national approach. And I know the Minister of Culture and Sport, Tourism, Culture and Sport in Ontario has been communicating with his counterparts in provinces and territories, indicating that he really would, he will support any of them who wish to implement this. Ontario is ready to help in whatever way they can. Other provinces to move ahead with something like a Rowan's Law or adopt the law as it is with all of its requisite recommendations and follow-up regulations, guidelines, etc., that have come out of it. I'm hopeful that with this Atlantic Canada group, there may be a window there into all of the maritime provinces to move forward with an idea like that. And I think would be very valuable to, it would take political will, but really the ground level work has been done in Ontario. It's the only, I think it's the gold standard for concussion legislation in North America and quite frankly, the planet. We've had inquiries from Australia, we've had inquiries from Scotland. regarding it. They're trying to get together the momentum to implement something similar in their countries. And there has been an interest from other countries as well, not looking at the pursuance, but they're looking at the law itself and trying to see whether something like that might move ahead. So there's interest around the world, but I'd really like to get Canada completely on board. That would be my first wish, what I'm pushing for now. And I'm hopeful that perhaps through this group and those who are affiliated with it, we can get some momentum, at least in PEI, but we're talking Atlantic Canada, even better. So that's pretty much my story, our story. And I appreciate the time everyone's put into this and allowing me to be a part of it. Thank you.
Again, our sincere thanks to Gordon for sharing his family's story. Very, very helpful here today. So which brings us to introducing our next guest, Dr. Gail McCartney. Dr. McCartney has over 30 years clinical nursing experience, including 8 in concussion care. She is currently a nurse practitioner and assistant professor in the University of Prince Edward Island's Faculty of Nursing. Dr. McCartney is also an expert panel member in the development of the Ontario Pediatric Concussion Living Guidelines. Sounds like a lot to offer here, so without further ado, I'll turn it over to Dr. Gail McCartney.
Hi, everyone. My name is Gail McCartney, and I'm really excited to be part of Concussion Awareness Week in September 2022. And I'd like to, over the next few minutes, just review some concussion basics as it relates to management for elite athletes. So in terms of objectives, I'd just like to review a bit of the context and some of the challenges around concussion care and really speak to initial concussion care and management. Dr. Atkinson is going to follow up with some more specifics, but I'm going to start with an overview. So in terms of the context, statistics-wise, we know there's about 4,600 concussions that were diagnosed between 2016 and 2017 in Canada in the 5 to 19-year-old age group, with a slightly higher percentage or number of males being affected than females. And the majority of those concussions occurred during sport or recreational activities. And some activities are more significant than others. Activities like ice hockey, rugby, ringette, accounting for 44% of those concussive injuries. Another important question is really, what do people know about concussion? And from the same survey, we found that really most people, 1 in 2 people, really had very little knowledge about concussion. They didn't know too much about the diagnosis. They weren't sure really how to, they were aware of compliance issues around head injuries, and education and training was also lacking. So this gives us really good impetus for events such as this one to address some of these issues. The first thing we think about concussion in athletes and individuals is that oftentimes people suffer in silence. It's an invisible injury and has been referred to this quite often. It's not like breaking your arm or breaking your leg where you have something very visible to everyone around you that you've been injured. And athletes and individuals sometimes suffer in silence, and we really want to move away from that. So quickly to review, what is a concussion? What are some of the features of a concussion? Well, first of all, you don't have to have a direct blow to the head. So it could be an indirect blow, maybe to your head or your face or your upper body or another area with impulsive forces that move to your head and cause your head to shake. There's usually rapid onset of some short-lived impairment of neurologic function that resolves spontaneously. And it's usually a functional disturbance, not a structural disturbance. So things like now imaging studies are not helpful to diagnose a concussion in this day and age, perhaps down the road. concussions result in a graded set of clinical symptoms that may or may not involve a loss of consciousness. So a loss of consciousness is not required for concussion diagnosis. So we really think about concussion as an energy crisis. There are your mitochondria in your neurons in your brain get affected, and they're just not able to produce energy as normal. So cognitive energy, physical energy is impaired. There are changes in metabolism, ionic changes, lots of excitatory neurotransmitters that get fired, causing depolarization, impaired neuronal function, and the symptoms can last for days to weeks to months. In terms of the signs and symptoms of concussion, we also often think about the physical symptoms, headaches, nausea, dizziness, sensitivity to light and sound, but there are also important mental issues that sometimes occur around difficulty focusing and concentrating, feeling slowed down mentally, some mental fogginess. Also important sleep considerations. Patients report having difficulty falling asleep, staying asleep, sleeping more than usual, not feeling rested when they get up, which, as you can imagine, can cause a lot of other difficulties in day-to-day functioning. And also very importantly are all the emotional issues that we sometimes see in concussed athletes, irritability, anxiety, depression, feeling sad, feeling not your usual self, which can be very disconcerting. It is important to just quickly identify some of the red flags that we have up on the slide here. I won't go through them all, but it is important to understand when individuals need to be navigated to emergency services, such things as increasing severe headaches or decreasing level of consciousness, persistent vomiting are some examples. So typically when you're assessed at the sideline or in a clinic or by your physician, some sort of post-concussion symptom inventory is typically done, such as the one you see here, where symptoms that are commonly associated with concussion are rated on a scale of 0 to 6, with 0 being no symptoms and 6 being the worst possible severe symptoms. As you can imagine, these symptoms are not 100% just purely concussion related. So people can have headaches in their daily lives normally, or some levels of fatigue, or some difficulty falling asleep, or sadness even. So it becomes important to tease out what everybody's normal baseline is and to try to understand how these symptoms are impacted specifically by the concussion. And our goal as the clinicians is always to get people back to their baseline, which for some people is not 0 on all symptoms. So the really important things to remember when managing a concussed athlete are the 4 R's: recognizing the concussion, removing them, referring them, and safely returning the athlete to activity. So thankfully, we know that most individuals respond very well to conservative measures. And the new guidelines involve, resting your brain, cognitive rest, resting your body, physical rest, for a period of 48 hours. So that's, it's not going into a dark room for a month, because we know people who used to do that did not fare very well. So a short period of cognitive rest, and then a gradual return to normal activities. And we do also know that some recoveries are very straightforward. Everybody's concussion history is different, and everybody responds differently. But for the most part, individuals will improve with this kind of straightforward approach. The next slide is a pain spiral, and I've taken this from the literature around chronic pain, but I think it does apply in some cases to some lingering symptoms of concussion that don't go away. In the sense of an injury like a concussion causing a symptom such as pain, perhaps headache, and your headaches are not managed properly, and then you get into kind of deconditioning because you're not being as physically active as normal, and then you might start getting fearful, you might feel a bit isolated, not going to your normal team events and activities, and then getting depressed and having sleep problems. And so this is kind of the downward spiral that we don't like to see, that we try to prevent as much as possible by actively managing symptoms in a concussed individual. So the following slide really shows how we want to focus on improving those outcomes by increasing activity, reconditioning as appropriate, having some social outlet. That will make people feel better from a self-esteem perspective, improve motivation, and then focusing on this kind of function-centered life. So in my practice, I describe to individuals a 3P approach. And it includes physical interventions, psychological interventions, and things like pharmacologic interventions or medications, over-the-counter medications like Tylenol and Advil for headaches, or perhaps something like melatonin to help for sleep during the acute phase. It's also very important to think about basic supportive care. People sometimes forget about the importance of having an adequate diet, eating good quality meals perhaps more frequently. Low blood sugars can trigger headaches, which might an individual may be a little bit more sensitive to. Maintaining good hydration is very important. Your brain likes to be well hydrated during recovery. Having a good sleep routine. There's some excellent tools. Headaches happen for a multitude of reasons, and it's important to try to eliminate all potential causes when you're in the recovery phase. Getting some accommodation to return to school or work is also very helpful to ease people back into their normal routines and allow them to gradually return to their activities. Next is physical activity. So physical activity includes things like perhaps physiotherapy. Physiotherapists can be extremely helpful for vestibular ocular problems or balance and eye issues, secondary whiplash issues to the neck, causing perhaps headaches, balance issues, reconditioning, etc. Also, massage works very well and complements these kinds of therapies. There are a whole lot of other types of therapists, and I won't go into detail, but this is just an example of a couple. Returning to low-risk physical activity is also helpful. Things like walking, stretching, yoga, Pilates, with gradual reconditioning. I think Dr. Atkinson will provide some more clear guidelines related to that specifically. Perhaps the most important aspect that I think is often neglected in the patients that I see is the psychological side to recovering from a concussion. It's very important to identify and manage stressors. That could be social stressors, being away from your sport, school, relationship, financial, etc. And using what has worked for you in the past in terms of managing stress, relaxation, meditation, or finding some new apps. Anxiety Canada has a fantastic app that's free that you can download called MindShift. Things like that you really need to include in your repertoire for life and for concussion recovery. And then draw on the resources that are available in your for counseling, for example, from your team or your school or your community or care providers that are involved with you. And again, also think about very broadly about stress management can be multifactorial. Just being around your friends and laughing, or doing some exercise, getting good sleep, meditation, going for a walk in nature. These are really excellent strategies that can help reduce your stress level and will also lead to symptom improvement across domains. So my final slide is really just about trying to balance. I think the most important thing in concussion recovery is you have a certain amount of gas in your gas tank and you have to manage it with balancing cognitive activities and physical activities. And a day that you do a lot of one is perhaps a day that you don't do a lot of the other, so that you don't empty your gas tank out too quickly. And I'm leaving up the final slide on the pediatric concussion guidelines that have some fantastic resources there for individuals and care providers. So thanks for your attention.
Thanks again very much, Dr. McCartney. And next, our guest is Dr. Tina Atkinson. She's a sport and exercise physician right here in Dartmouth and is also the Chief Medical Officer for the Canadian Sport Institute Atlantic. Dating back to 2012, Dr. Atkinson is a founding member of Concussion Nova Scotia, an interdisciplinary group working to improve the awareness, management, and diagnosis of concussions here in the province. Let's turn it over to Dr. Atkinson now.
Thank you, Adam. So today I'm going to talk about managing concussions specifically in athletes, and especially the tricky part, which is identifying persistent symptoms and realizing when you need to intervene and address those symptoms so that the athlete can fully recover. One thing I want people to remember is that most concussions do recover. Most people with concussions over the age of 18 do recover within 2 to 3 weeks. That means their symptoms are fully recovered and they have what we call just a sort of a normal, uncomplicated recovery. There are a small percentage of people, 15 to 20%, who can develop persistent symptoms. So the symptoms are lasting longer than 3 weeks. And in adolescents under 18 children, that can be 3 to 4 weeks is a normal recovery, and anything past 4 weeks we would consider complicated. At that point, it's important to assess that patient again and decide what symptoms they have and what needs to be treated so that you can ensure they have their best and full recovery. As Gail discussed, in the first 48 hours, it's really important to rest. You want to physical rest and you want mental rest. So that means staying away from anything that would make you worse. A lot of people try to rush this step, or they're also told to rest too long, and both have shown to prolong recovery. What I suggest to people is after the 48 hours, you may not feel 100%. It's great if you do, but even if you don't and you still have symptoms, we want you to start some light activity. We want to put you on a sleep plan. In the first 48 hours, it's fine to sleep as much as you can, as much as you need to. But after the 48 hours, we really need to get you on a good sleep plan with a consistent bedtime and wake up time. At that point, after 48 hours for an athlete, especially if you have a trainer for your team or a therapist or a team physician, we want you to have a physical exam, especially looking at the neck, and do a visual assessment if you have any visual symptoms. After 48 hours, like I said, someone should assess what is happening with your sleep. Are you able to sleep? Are you getting a good night's sleep? If you're not sleeping, then your symptoms are not going to improve as quickly. There can be many reasons why people don't sleep. A lot of reasons Gail went over already, such as mental health, such as headache, worrying about the future, which would cause the mental health issues, just generally being uncomfortable, or sometimes you're sleeping too much during the day. As with any person that is having trouble with sleep, we want to put them on a plan of what we call good sleep hygiene, which means eliminating screens and a lot of stimulation right before bed. So you want to turn off your phone about an hour before you go to sleep. No caffeine, no exercise. You should be just doing the light activity at this point anyway, but not doing it too late, like after supper, and addressing any pain they might have from a headache or from neck pain. I like to limit the naps to 1 a day, or try to eliminate naps altogether at this point. And the nap should be 20 minutes or less so that you don't wake up feeling more groggy. As I said, it's important to have a consistent bed and wake time. Your brain likes that regular rhythm and pattern. I'd suggest getting natural light first thing in the morning, and then you need to make a schedule for your day and incorporate breaks into the day. As Gail was mentioning, you need to pace yourself. Some people can do more physical activity, but not as much mental activity, and other people are the opposite. So for the physical activity, the daily light activity, we start with just 10 to 15 minutes of walking to a maximum of about 20 minutes. Some people prefer stationary bike at that point. What I do is use a heart rate target to guide how long and how intense they can do that activity. We want to find the exact right amount of activity that does not increase symptoms. So you might still feel symptoms while you're doing that activity, but we need to, it's important, and we know that it will help improve recovery and possibly even prevent those persistent symptoms. So what we're looking for is a sub-threshold aerobic exercise level that does not increase your symptoms. There are some tests that you can do to try to find that level, and one is called the Buffalo Treadmill Test, which a lot of teams and athletes and schools use now to assess the level, that heart rate level above which your symptoms increase and below which you feel the same or actually sometimes feel better. So as far as the daily activity, if it's going well, you want to increase that each day as your symptoms allow, and then start the return to play guidelines. So at this point, you're in the concussion protocol, and we need to look at getting you back to your regular life, which for an athlete, we do the return to play and the return to learn or work at the same time. So you're going to do both of those in parallel. Just want people to remind everyone that you have to be completely back to school or your activity outside of sport before you can be cleared for your contact sport. This is an example of a return to school protocol. And as you can see, it consists of several stages. This graphic is from New Brunswick Trauma, who has done a lot of work on concussion protocols and concussion awareness and education on their website. So I like this one because it describes exactly how you should go about things and how you should move to the next stage. The first stage being rest, which, like I said, should be for about up to 48 hours. And then you start daily activities at home that would mimic some of the things you would do at school, such as reading, working on the computer. This would be, 15 minutes maximum for stage A, for instance. And then every 24 hours, if you've tolerated that activity and you don't have any increase in symptoms, you can move to the next stage. So each stage would take at least 24 hours. Sometimes it takes longer until you're starting back to school with accommodations. Like I said, for an athlete, you are doing this return to school protocol at the same time as your return to play protocol. And I'll show you that now. So the return to sport, return to play protocol looks very similar, and it does follow the same guidelines, but just different specifics to each stage. So again, the first stage is rest for 48 hours. Stage 1 is the daily light activity that I discussed, and that's that sub-threshold aerobic activity that we're looking to find how much you can do and how intense that it doesn't increase your symptoms. And a lot of athletes actually feel better when they start to do aerobic activity that feels more like themselves, and they feel confident that now they're moving again, they're going to be able to get back to their sport. So again, you want to take 24 hours in between each of these stages. Some people take a little longer. If the symptoms increase significantly, then you don't have to go backwards, but you want to stay at the stage where you were. So for instance, if you get to stage 2 and you're on light aerobic activity, you felt pretty good. The next day, you want to try a little bit more, which would be sport-specific type of activity. So for hockey, you would be skating with no contact, no gear. For football or rugby, you would be out running, doing a little bit more intense running. If that started to cause increase in symptoms, then you would stay at that stage. You wouldn't go forward. So everybody is a little bit different. Everybody responds differently. And we just use this as a guideline to guide you back through the stages so you can fully get back to your sport. For athletes, it's important to recognize the symptoms that are not improving pretty quickly. So we often, like I said, you're assessed at about 48 hours when you're ready to start doing some light activity and do some light cognitive activity. But we want to reassess athletes quite frequently throughout that first week to make sure that they're not developing any of the symptoms that Gail talked about earlier, which very predominantly can be mental health symptoms. They're worried about, am I ever going to be able to play again? What's my future in this sport? Am I going to be able to get back to school? Sometimes it's I only have a little bit of eligibility left and I don't want to ruin my year. So these are all the things that I know go through athletes' mind, and as I said, that can interfere with sleep as well. So we want to recognize that right away, address it with the athlete, and have an open discussion about it. At this point, it's also important to communicate in the first week, open communication with your trainer, your team doctor, your coaches is really important to make sure that everybody's on the same page and everybody knows how things are going. As I mentioned, persistent symptoms can occur in up to 20% of people. Very common as well when you have other stressors, such as when you're in university. I often see athletes in grade 12 that are having a hard time, and then professional athletes as well obviously have other stressors. So at this point, we want to identify which symptoms are there and which can be treated, and then develop a treatment plan. At that point, once we've identified the symptoms, and there are certain categories that the symptoms fall into, and I'm going to show you that in a minute, we want to refer to the appropriate health professional that can help treat those symptoms. So as Gail mentioned, that could be a physiotherapist, it can be your strength and conditioning coach, it can be a psychologist or a mental performance, mental skills person, athletic therapist, chiropractor, and sometimes when you're trying to get someone back to work, occupational therapist as well. They can all help treat those symptoms and work together to get the person, the athlete, back to their sport and back to school. So this is a graphic which just shows the different categories that often the symptoms fall into and how they kind of all overlay and are connected to each other. So for instance, headache on the bottom there, all of the other symptoms can affect a headache. So if you're having trouble thinking, concentrating, paying attention, those cognitive symptoms, that can give you a headache. If you have some mental health issues arising with anxiety, feeling sad, depressed, feeling, like you don't have a future in your sport, then that can give you a headache. The visual vestibular symptoms are often blurry vision, or your eyes are having trouble tracking, such as when you're reading. That can make you feel very dizzy. You can perceive, your brain sort of perceives that you're off balance. That can also cause a headache. Neck pain is not on this slide, but if you have a secondary or neck injury with the headache, with the concussion, then that can also cause some vestibular issues and also can contribute to a headache. Fatigue is one that often we see as all the other symptoms are getting better. Fatigue can often actually come to the forefront, and it's very difficult to figure out where the fatigue is from, but often it's from a combination of all of these things. The other one that I want to talk about is the autonomic symptoms. So that means when you go to do something that's relatively light activity and you're a fit athlete, but your heart rate spikes and it makes you feel really unwell, that's called an autonomic dysfunction. And in that case, that's to try to prevent that symptom, another reason why we do the light activity early, but we don't do too much too soon. So the way to treat that one is to gradually increase how much you're doing as far as intensity of exercise. And at that point, your coaches, and especially your strength and conditioning coach, can really help work with you to prevent the autonomic system from sort of overreacting. So with the persistent symptoms, the main message is the athletes need support from everyone around them. It's really important that everyone that's part of their team, including parents, friends, coaches, school administrators, educators, are all speaking the same language. Everyone needs to support them and understand that their journey to recovery is going to be different from someone else's, or even a previous concussion that particular athlete might have had. We want people to understand the injury. As Gail said, it's an invisible injury, but we know so much more about concussion. We know how to address the symptoms. We know how to make a treatment plan, and we also know the recovery timeline. I still get a lot of questions from people saying, it's been a week, I should be feeling better by now. And that's why I mentioned that often it can be 2 to 3 weeks, and that's still completely within normal, within the usual time. So again, the recovery plan is unique to each person, and actually each time they have a concussion, it can be slightly different. There's no one size fits all. Make a communication plan with everyone involved. Some athletes like to have someone check in on them every day. Some athletes don't want to have somebody check in on them every day. They don't want to answer those questions over and over again. So it's important to make a plan, figure out who is going to communicate and how you're going to communicate with your trainer, with your team, with your coaches, and with the school. we want the athlete to feel supported, and that really helps with their full recovery. This is just a slide with other resources that I usually use. And if anyone wants any information about anything that I've talked about, you can find it on this reference, on the links that are on this reference page. Thanks very much.
Thanks again, Dr. Atkinson. Next up is Nova Scotia hockey athlete Lee Denny. Hailing from Cape Breton Island, Lee's here to share his story with concussion in the hockey world.
Delawesi Lee Denny, Tleoi Unomagi, Elnoegari Delawesi Eskizoni. Hi, my name is Lee Denny. I'm from Cape Breton in a Mi'kmaq community called Eskizoni. As long as I can remember, I've been on the ice. Our community is kind of competitive in hockey, so everybody wants to play hockey, everyone wants to win. I love everything about it. I consider myself a playmaker, so I like making plays, I like to compete. I started pretty young, and my dad always put a stick in my hand and he put rollerblades on my feet. Started out playing roller hockey in the house and eventually ended up on the ice. So I understood what concussions were when I was older, but I never understood it until I got to junior hockey and the doctor told me I was diagnosed with a concussion. That's when I kind of took it serious at that age. My last one, when I played junior A, that one was kind of serious. I knew I needed to take a break from hockey to focus on my health. It wasn't until I played the next year in junior B, and that's when I got my major concussion. I collided with a player, hit me in the head, and I just collapsed on the ice. And I crawled off the ice after that. After I got hit, I went to see a doctor at a local hospital, and I had to stay overnight because I was puking and having headaches and I keep blacking out. So they told me to stay overnight. The next morning I spoke with 2 different doctors and they told me I shouldn't play hockey anymore. If I can go back, I would definitely tell my parents that I've been hit to the head. I did see stars. I do have a headache and I probably should get checked out.
Thank you very much, Lee, for sharing your story. Next up is former Snowboard Nova Scotia athlete Keita McRory. Aside from her athletic days, Keita has stayed involved in the snowboard community as a head coach of our Snowboard Nova Scotia speed team and is currently involved in the programming of athlete and coach development across the country with Canada Snowboard. A concussion victim in 2009, Keita is here today to share her story.
Thanks for having me, everybody. I'm stoked to be a part of the Atlantic Concussion Awareness Day. In 2009, I was in a snowboard accident. So it was a provincial level competition in the event Parallel Giant Slalom, which is a alpine snowboard discipline. I was competing against one of my teammates, and she ended up catching her edge, which meant that as she was coming, we were both coming down, she caught her edge and ended up going into my lane. So I threw down a toe side to try to avoid her and ended up crashing into the timing shed at the bottom of the hill. If in the video, you'll see that my head essentially like bounces off of the shed. Don't really remember that much. I remember waking up being like, where's my snowboard? Because snowboards are very expensive. Ski patrol checked me out, and then my parents were there, so my mom kind of took me into the chalet. And then I guess the side of this is that this was the first provincial level event that I was about to win in the women's open class. And so I didn't really take the injury that seriously. I was like, yeah, okay, whatever, it is what it is. Went outside, grabbed my snowboard, snuck up the chairlift, and then went to the top of the course and said to my coach, that was interference, she's disqualified, I'd like my rerun, please. And he hugged me, said, never do that again, and no, go back down and recover. Then I found my brother, and my brother was like, hey, do you want to go ride the trees? And I was like, yes, that sounds like a great time. So then we snuck off and spent the rest of the day snowboarding in the trees. And then the next day, I was scheduled to coach what was called a pro girls snowboard clinic. So I coached for about 3 hours, and then by the end of the session, I couldn't really walk right. I had a lot of pain in my knees, my hips, and my side. And luckily it was reading week because I was a university student as well, so I was able to just kind of recover. But I personally felt that there was no major symptoms there. Going back to university would say something else, where I basically slept through every single course, could not remember anything. I remember there were physics kappas that we had to do, and I was working on it with a former student, and he looked at me like, what do you mean we literally just learned this in class 2 seconds ago, you have no idea what this is? And it looked like gibberish to me. Still kind of played it off, fell asleep for a lot more classes, but it wasn't just like, oh, I'm bored, I'm gonna sleep. It was like I physically could not stay awake. And then I ended up sleeping for 24 hours, still went back to school, and was hanging out with a few of my friends in, I don't even remember what building, but at Dow during like an in-between period. And we were talking about video games. And they asked me a question about Majora's Mask, which is one of my favorite video games of all time. And I couldn't remember anything about it. Now, at that point, I'd beaten that video game like 5 or 6 times, could do it like off the top of my head. Couldn't even remember the storyline of the video game. The only thing that I could picture was the gold N64 cartridge. And so that's when I was like, you know what? Okay, there's probably something wrong with me at this point. Called my mom, she takes me to the emerge. We wait the like 10 hours to get x-rayed. And then I went back the next day for an MRI. Obviously concussions, you can't diagnose them with stuff like that. So the only thing that they said was, yep, she's cracked her ribs. And then essentially I just realized that, okay, I have a concussion. I stopped working. Luckily, my employers were really understanding and said, take all the time you need. And I went to the bare minimum of classes that I possibly could. I basically failed every exam after that because I could not remember anything. The only reason why I was able to come out of that semester with like C's was because prior to the concussion, I was a straight A student. Recovery from that was pretty difficult. To say the least, I was drinking like a bottle of wine a night, super depressed because I couldn't do anything. I could not work out. I could not snowboard. I couldn't play video games. And that was when God of War 3 just came out. So I was super upset about it. Dropped down to 90 pounds, basically stopped eating. And yeah, it was pretty brutal. Anyways, obviously I'm here and fine, but it took a while to recover from everything. I started taking summer courses and realized that I couldn't learn the same way that I had prior to the incident. Before, I was able to read something a few times over and it would be in my brain. I would be able to say, okay, I have to do this assignment and just sit down and bang out the entire assignment. After that, it was pretty difficult. I had to figure out new ways of learning. I had to figure out new ways to stay on task and motivate myself. Since then, I have been diagnosed with ADHD, which is something I did not have before the accident. One thing that I would like to tell all the athletes and the coaches out there is when in doubt, sit it out.
Thanks, Keita. And now to get a trainer's perspective, we're going to catch up with football Nova Scotia athletic trainer, Jenny Weisner. Let's watch Jenny's story here now.
My name is Jenny Weisner. I'm a certified athletic therapist and I work with Football Nova Scotia. I think my first real memory of sport was playing basketball when I was a kid. I just loved the environment. It was exciting being a part of that. You know, working with teammates, being a team player, I always enjoyed it. So I always tried to stay busy, stay involved in whatever capacity that looked like. For me now, is as an athletic therapist on the sideline. I love it. The competition spirit is always there and the athletes are incredible that you get to work with. I got a concussion when I was 7 years old, and it wasn't playing basketball, I was skating. And I was wearing a helmet, thankfully, but something happened, I lost my footing, I fell on the ice, and I landed right on the back of my head. Can't remember much beyond that, other than that initial injury, and going home that night and how awful I felt. I often give the example of an ankle injury. And if you sprain your ankle, it's easy to know how to manage that because you can use pain as your guide, right? So if it hurts to walk on your ankle, if it's sprained, you don't do that. But with concussion, if your brain is injured, it's not as easy to make that distinction. My rule of thumb is to, when in doubt, sit them out. If I'm not sure, then we'll just sit them on the sidelines so we have a chance to reassess. I hate the term bell rung. Hearing that on the sideline or hearing coach say, player got their bell rung, it's not terminology that we use in football because it trivializes the injury. People often think that football is a risky sport and that, concussions are a huge injury risk or issue or concern. But the reality is there are far riskier sports that athletes can play, and that we work really hard to make sure that our coaches recognize and our athletes recognize signs and symptoms of concussion. And it's really great to see other sports taking that seriously because that keeps all kids safe.
We very much appreciate Jenny's contribution to the program today. Next up is Stephanie Cowell, Director of Knowledge Translation for Parachute, Canada's national injury prevention charity. Through her work with Parachute's concussion initiatives, Stephanie has worked with over 50 national sport bodies in her time. Let's hear from her.
Hi, everyone. So we want to leave you not just with the great information and story sharing from this session. We also want to leave you with information about what resources are out there for anyone in Canada and how to access these resources. And there's great information available no matter what your role. If you're someone participating in sport and recreation, if you're a student, if you are a healthcare professional, a teacher, a coach, there are great resources out there for you to access or for you to share with people that you'd like to raise awareness with. And so I'll be giving information about those resources. First, I wanted to share a little bit about Parachute, the organization that I work for. We are Canada's national injury prevention charity. And our mission is to see Canadians live long lives to the fullest, but without those lives being impacted or cut short by serious or fatal injuries. And concussions and other injuries in sport and recreation is one of our priority areas. So we've been doing work in this area and getting good quality evidence-based information out there about concussion for years and years, and working with our partners in health, sport, government, education, you name it, to have consistent information to just help people better understand this topic and empower people with what they can do and just to learn more and feel equipped and prepared. So I'm going to walk through just a few examples of the resources available. To start, it's important that everyone know that there's some great free evidence-based education and training available across Canada. The concussion awareness training tool is developed in British Columbia, but it's available and applicable nationally. And there are free modules for, again, people with all sorts of different roles. If you're a health professional, you can take an accredited CME course to learn more about concussion assessment, what information to give patients, and how to follow up. And I want to draw your attention specifically to the CAT for Youth, which is a brand new launched module specifically aged at young people around high school age, so they can get information about concussion, what to do, what they should be aware of, and how they can help their peers as well. If you are a coach, you may already be familiar with the Coaching Association of Canada's NCCP Making Headway in Sport module. And if not, absolutely anyone can access this course. It's great scenario-based learning, thinking about the judgment and decision-making that comes when you're working with athletes or students and have to make some decisions about whether they should be removed for concussion and how to safely bring them back to participation in activities. And I just want to take a moment here and mention that all of the resources I'll be mentioning are available in English and French. We have lots of great general information on our website at parachute.ca, information about concussion signs and symptoms, resources about return to sport, school and work, and all of these are free to access and share. We also have a free Concussion Ed app, so you can have this information with you on the go. It includes a concussion recognition checklist if you need to access this information wherever you are. It also provides you with the opportunity to personally track your symptoms and communicate this information with your healthcare team and your school and sport team if you wish to share that information. We have excellent evidence-based guidelines in Canada that look at the evidence as well as expert opinion and provide guidance to professionals as well as those working with in and around sport. So we have clinical practice guidelines that are continually updated for both pediatric and adult populations. It's really important that healthcare professionals have their practice up to date as information evolves about concussion. We also have the Canadian Guideline on Concussion in Sport, which kind of identifies the information that sport organizations and coaches and parents and officials and others need to know about concussion and sport, and really distills that information down and considers how to implement best practice for a sport organization. Coming back to the Parachute website, we have collections specifically for schools, sport organizations, and health professionals, as these are entities that have specific needs around information. So you'll find all sorts of information about updating your own learning, resources you can share with families, with patients, with athletes, and so on. So I encourage you to check out those collections. There's probably a resource existing for what you need, and we don't need to worry about recreating the wheel. Finally, I wanted to mention that we now have a Canadian Concussion Network in Canada, really focused on concussion research and knowledge translation, and encourage all of you to check out the network at ccn-rcc.ca and consider joining the network. Thank you so much.
Thanks very much, Stephanie. And now we've reached the question and answer portion of our evening. Pleased to have Keita and Dr. Atkinson back with us here. Appreciate the time very much. And thanks to all of you who submitted questions online through the registration portal. There were many great ones. We tried to pick out a few here tonight to best suit as many kind of areas as we can. So, Doc, I'll start with you. You mentioned in your presentation a lot around mental health and the piece, how it fits into concussions. We all think about being cleared to play in a physical sense. Talk about the mental health side of being cleared within concussion protocol.
Yeah, that is an important aspect. So now we know we need to take into account the psychological readiness. So there's the concussion protocol, which we just talked about, and most athletes have heard those words. They understand what that is. They go through the steps and they do well. They don't have any symptoms, and then they come see me or their team trainer, their team physician, and they get cleared to play. At that point, there are some athletes that are just not psychologically ready to play. So when I'm trying to clear someone to play, I look at how they went through the protocol, they go through all the physical tests, and then we do a psychological readiness questionnaire, some question and answer, some dialogue, and just make sure that they're actually ready. Sometimes they're not, and it takes them a couple of more steps, and sometimes they're fine and they're ready to go.
Yeah, and I mean, Keita, you can speak to this personally as a snowboard athlete yourself. You might have gotten over the physical symptoms of concussion. Tell us about your experience in the mental piece of kind of jumping back on the snowboard and having that confidence to get back out there.
Yeah, definitely. It took a while, I would say. I essentially had to take the entire summer off. The unfortunate thing is that summer I was invited to go train with the national snowboard team out in Calgary. So I was set to go move out there, and of course had to delay that a little bit. Which ended up, it wasn't a bad thing, because instead of just forcing myself to get right on snow, I was able to really take it slow with the provincial snowboard team and just really work on getting back into it. You know, it took a while to feel comfortable again. You know, a lot of just like blue gree runs, going down different drills, just trying to get back into it. But then, you know, got really into it.
You got
again.
back in
yes,
there.
Thank you.
That's the main thing
Words.
for sure. No, that's great. That's great information to share. The next one on our list is more of a technical piece, and Dr. Atkinson, I'll give this to you. People are asking a little bit about the value of a mouth guard in sports in terms of concussion, and how I guess it would affect prevention / management if you happen to get hit. Tell us a little bit about mouth guards in your opinion, and even the technical side of which may be better than others.
I don't have a particular brand. And as far as we know right now, there is a lot of research being done on this, but we don't know of any particular concussion that definitely reduces the incidence of concussions or how many concussions happen. Like I said, that is an area of research, and hopefully we'll get more information on it soon. There are some mouth guards that have impact sensors and things like that. That's part of the research. What a mouth guard does do is protect your teeth primarily and protect another severe injury if you get an impact to your face or your head. So you want to use a custom mouth guard that's long enough that it protects the entire area.
Sure. And so, the mouth guard, that's just one kind of piece people wonder about. Keita, in general, how do you think we continue to kind of best educate athletes and parents and different things regarding concussion management, whether it's mouth guards or other pieces of information? Do you have some resources that you could recommend?
Yeah, definitely. Step one would be always go to the coach. Coaches have hopefully received adequate training in regards to this. There are resources like the Making Headway in Sport, which is a free online learning module done through the Coaching Association of Canada. Most coaches within Canada have to take that, but it's also great for parents and athletes to be educated as well, just so that they know what to look out for.
Yeah, absolutely. And one last kind of specific question. A user submitted a question that asked, what are the best questions to ask a youth immediately after a suspected concussion? Doctor, I wonder if you can kind of share some light on that one.
That's a good question, and something that I often see is done maybe not the best way. So a very common question people ask is, are you okay? Are you good? And that's a very easy question to say yes when actually they're not feeling very good. So I usually ask them, I suggest that people ask a very specific question. Do you have a headache? Do you feel dizzy? Do you feel like you're yourself? Do you feel off? And then you're more likely that athlete, even in the middle of a game with the adrenaline going, or they're more likely to reveal that, that actually they don't feel that good. Very important to mention that sometimes you don't even have to ask a question. You've just watched what happened. If you've seen the mechanism of injury, you've seen them fall, seen them try to get up, and just not acting like themselves. If you know your athlete, you know that they're not okay. So we ask the questions just to kind of confirm, but oftentimes you have a high index of suspicion that there's a concussion, possible concussion anyway, and they need to come out and they need to go in the concussion protocol.
Yes, that's kind of at the initial stages. And a follow-up to that, I guess, a lot of users are wondering about the more longer-term effects of not just one concussion, but multiple concussions.
Yeah, I mean, what we've seen in the past is that people go back to sport too soon. So they're not fully recovered. They fall or they get hit again, they have another concussion before they're fully recovered. Obviously that can be a catastrophic injury like the second impact syndrome that we've heard about with in Rowan Stringer's case. But there are other instances where people just continue to have more symptoms, and each concussion they get a new symptom or that symptom gets worse. And they'll tell me after the fact that actually I never felt 100% after my first one. And so those symptoms can be long lasting. There's a lot of mental health disturbance associated with that. There's often a lot of guilt. There's a lot of regret. So we want to treat this as an injury, and you need to recover from that injury, whether similar to if you had a broken bone, you had another injury that was obvious and someone could see. We treat those injuries like they need to be taken care of and they need to fully recover. In the past, we haven't treated concussions that way, and we just need to start treating it like an injury, go through the protocol, make sure you're 100%, and then you can go back.
Yeah, great advice there. Some great insight on that one. Keita, one question around long-term effects, and it came from some of our youth questions. Talking about school performance in particular, you have concussion, you come back, you're not only getting back into your sport, but often into your everyday life. And if you're in school, the education piece can be a challenge. What was your experience like? You were around that age bracket when you experienced yours in 2009.
Definitely. It was long and hard and painful. That was the Keita versus Shed was essentially concussion 3 or 4. So I don't know if that would have been 1 or 2, if things would have been different. but it was a really long road just because of having to relearn how to learn or utilize different learning techniques that I'd never had to do in the past. The big component was the memory thing, which still affects me to this day, where if I don't write something down, it's gone.
Yeah, sure. I mean, and common things that I'm sure many are experiencing and not happy to see, but I guess someone to relate to within that kind of realm of things. We jumped around a fair bit there in terms of what we touched on. Again, there were many questions. We tried to pick and choose from the different areas as best we could. Again, thanks to everyone who submitted one. Maybe we didn't get to it here tonight, but again, lots of resources that we talked about here tonight available out there for you as well. Before we kind of conclude the Q&A session, I'd like to open up the floor to each of you. So kind of some final thoughts. Lots of great information was presented today. I guess, Keith, I'll start with you here. How would you kind of sum up Concussion Awareness Day here for 2022?
It's great.
It
really
is
happy
great.
to be involved.
It is great.
And I think that it's really important. You know, a big thing when I was going through my own coach education, you know, you always hear, what do you do if an athlete is competing in the best event of their life and they get a concussion and the parents don't want them to be pulled out? Well, pull them out, because it could ruin the rest of their lives for one competition.
Yeah, sage advice there without question. Dr. Atkinson, final thoughts?
Thanks. You know, for me, these sessions that we've done last year and this year have been really important. It really helps me do my job when I have an athlete or a patient in front of me that has a suspected concussion or, you know, a diagnosed concussion. We're trying to get them back to their regular life, back to their sport, back to work. If they understand what I'm talking about, they've heard this before from sessions such as this, these awareness education sessions, it makes my job a lot easier. It also is helpful if everyone around you, like I mentioned, your team of people understand what you're going through, and you can recognize it in yourself if it happens to you, and you can recognize it in someone else. I think we can all be concussion educators, and it's really important to, you know, all give the same message and discuss what we've done and acknowledge and discuss and amongst friends and everyone in your circle what we've talked about today.
Yeah, I love that. In a nutshell, we can all be concussion educators.
Yeah.
That's fantastic. And the reason I think why we're all here today. Can't thank you both enough for both your presentations earlier and the Q&A session. Appreciate your time here tonight. And thank you to everyone for joining us. This wraps up Atlantic Concussion Awareness 2022. We certainly will look forward to seeing you here again next year. Wishing everyone good health and a great evening from Dartmouth. So long.